Morning, my name's Laura. I'm the ward manager and registered mental health nurse. It's 10 to 7 in the morning and I'm about to start my early shift. Okay, and here's the team. Say hello.
Hi.
Hi.
Well, the COVID-19 pandemic has changed everything about the inpatient mental health services, particularly in the early part of the infection. Examples of that include redesigning the service away from a locality-based reception ward to a COVID-orientated system where there's acute wards that now are designated as a COVID ward or as a quarantine ward.
The service was fully redesigned about 5 weeks ago, so we now take all our admissions into the hospital here where people are swabbed. If they test positive, we place them down in this end here, encourage isolation. If they're negative, they go down to the other end.
Nearly everything to do with COVID polarised the way we work. So we very much work on social inclusion, least restrictive principles, community engagement. When COVID first hit, we had to really readdress all of those aspects of our core business.
Due to this crisis, we're unable to venture out of the hospital, so a lot of our activities have been done inside.
It's prevented families visiting, and the very important connections to the community have had to be diminished and restrained.
So I just made my way up to the unit. We've currently got a sign saying no visitors, which the guys are taking really well considering actually, because their families are normally really quite involved in their recovery.
It's changed a lot of very important comforting areas for people.
This is our dining room. As you can see, the tables and chairs are separated. Due to social distancing, we're no longer able to sit together.
If you're already feeling frightened and struggling to understand the world around you, COVID-19 has brought a whole new layer of complication to that.
The effects COVID-19 coronavirus has had on me, it's affecting me leaving hospital, heading towards my planned discharge back to the community.
The impact is huge, it's impacting on everyone.
As a trust, as a ward, we've come up with procedures and plans around managing this, but it's still been really, really tricky and really difficult for people to deal with.
When we first went into PPE, some of our gentlemen were able to verbalise how they felt about that, and they didn't like it. They found it really quite intimidating.
In some ways it's been a positive experience. People have learned to come together, but in some other significant, although relatively rare examples, it's presented particular challenges.
Staff have been hit, they've been kicked, they've been spat at, but despite all of that going on, the staff have managed really, really well, and the other patients too.
We've had to think about how we best keep ourselves safe. We have good PPE here, but sometimes we do get concerned about will it actually be effective and actually does the PPE work.
In terms of the PPE we have disposable scrubs which we wear on top of our work uniform. We also have the availability of goggles, face masks, gloves, and visors for patients who are spitting at us. I think one of the biggest worries for staff was not only taking the virus home to their loved ones and families, but also bringing the virus in.
My wife, who also works for the NHS, contracted it and she was quite ill. She was off work for 3 weeks. During that time, I went to live in some local university accommodation so that I could continue coming to work.
Initially we saw quite a reduction in admissions to the hospital. I think people were quite frightened and were willing to try and cope in the community. As time's kind of gone by, we've seen an increase in the need for inpatient care. So we had redeployed staff coming from the community. We had second and third year students given posts on the ward, so given jobs. We actually reconfigured our therapy team, so they maintained a core service within the department, but redeployed onto the wards and worked in very different roles.
And over here we've got Alice, the Deputy Ward Manager. Morning, she's just checking our PPE stock for the day. All seems to be in order, and as you can see over here, we've got our visitors room. Unfortunately, due to COVID-19, it is now not a visitors room, and we're using it as a safe space for all the staff to get changed into their scrubs, masks, use a Clinal wipes, etc. to get all set up ready for the day.
Our use of information technology has massively improved, and it's certainly something I'll take forward in the future. We as clinicians are using things like Microsoft Team, which actually creates a lot more time in our working day. We've got iPads on the wards for people to be able to FaceTime with their family members.
So currently, Dan, we've got use of an iPad for you to keep in touch via Skype with family and friends.
There is a benefit to face-to-face contact, and I think we need to, moving forward, figure out how we do that in a safe way. Patients in the hospital have been very accepting, but at times they've come up with some very good ideas that we've been able to incorporate into our new ways of working.
The staff have family lives and they need to do their best and abide by guidelines to make sure we all stay safe as well as themselves.
The NHS generally and mental health inpatient services particularly have the ability and have demonstrated their capacity to work together and move past these challenges.
So we currently have 5 patients. We've got 2 patients that have tested negative, so we're just awaiting them to be transferred to a green ward.
Normally here on Montpellier, we offer a 7-day programme of largely community-based therapeutic activities, and we're having to adapt some of our practices at the moment by offering more ward-based activities such as this.
A lot of our guys were using the gym out in the community as part of their rehabilitation programme, but since the COVID-19 situation we've had to be a bit more creative about sort of what we do on the ward. So we've got Dan here and he's just showing you a few exercises as part of his workout that he's doing in the Montpellier gym instead.
I think going forwards we're going to have to manage a hospital with the ongoing COVID risk. I mean, COVID isn't going away in the short term. We need to try and move back to our core principles, our social inclusion, our group work, but we need to find new ways of doing that. There isn't a template for this, and I think we're going to have to do it gradually. There's going to be little steps, and we're going to be 2 steps forward and maybe 1 back as we move into the new ways of working, but I think it will change the way we work going forwards.
I often hear this idea of a snowflake generation, people that are in their 20s that can't cope, that aren't resilient. But I think across the range of our staff group, at all ages, particularly the younger community, they've been at work, they've shown compassion, they've shown determination, and I found it inspirational for someone like me in the twilight of my career that generation and this current group of people have been able to succeed in the way they have.
It's a very, very rewarding job, and I thoroughly enjoy working here.
I am constantly amazed by the staff that work in this hospital.
We're getting there, numbers are reducing, the isolation and the lockdown is working, just keep at it.
So arguably, this surge, round 1, we've come through it as a clinical and a patient community, and we're hopeful that the measures now in place will prevent a second surge.